Cleanliness, they say, is next to godliness. Mwanza District Hospital is today benefiting from the Japanese Toyota quality control model that has seen the country's economic turnaround and stand out as one of the best in the world. The district's health officer is implementing the model that is helping both the staff and the hospital, its resources, and those patronizing the health facility.
It is a requirement of the Ministry of Health so that all the health workers in the country should deliver quality health services to our customers. As you know, our patients are our customers, and all the time we have to make sure to work hard to improve the health care of the people. So in our hospital, when we started in 2011, we had to start with a situation analysis where we identified some gaps, and we analyzed those gaps. And from there now is where we started to implementing on how we can improve and correct those gaps. And one of the factors is to improve infection prevention, reproductive health, and again 5As.
But what does the 5As stand for, if one may ask?
5As is a model which was discovered by Japan, and is by JICA, who started it. And as a background, after the Second World War, and in Japan, you know, it was hit by the bomb, Hiroshima, Nagasaki, and the country was in a mess. It was dated, there were a lot of things there. So in Japan, they started organizing themselves, correcting their situations on how they can improve their country. So they used this model, which they call 5As, and they adjusted the 5 S's. And the first S is sort, and the second one is set, another one is the shining, standardize, and sustain. So using that model, in Japan they started assembling the nice car, which we call the Toyota. And using the Toyota cars, they found that they are the most brand new cars. They are very powerful, but at an affordable price, and they are all over the world. So using that model, they started now developing what we call improving healthcare system using Toyota model. And now this model is being implemented in hospitals. Now in our hospital in Mwanza, Japan again came to Malawi to start this initiative in some countries and in some districts like Chirazu, Chioro, Doha, Zimba, and Karonga. So when I arrived I have been in Doha for at least 6 months, and I learned that this initiative is a perfect one, which can improve the facility. You can even improve the health workers' attitude. You can mobilize your resources, and you use the local available resources, and you don't lose a lot of money. So when I came to Mwanza, I wanted to implement this same initiative of 5As, where we started as a team doing the sort, set, shine. Now we're just doing the 3As because we are just starting. We started last year, August. And we are just using our funding, which we receive every month, and to reallocate all our resources. And by doing the 3As, sort, set, and shine, we have mobilized a lot of resources within the hospital. And we are able even to reallocate to other departments. We are able even to shine our offices, even the walls. Now, with the 5As, it is like a catalyst, which is now improving infection prevention and reproductive health. So we are doing together with reproductive health, infection prevention, using the 5As model to improve those services.
Through the Japanese model, dealing with a day's work is made easier because everything is put in place and life is made easier for the daily business.
Coordinator of 5As, my role mainly is to supervise, to coordinate. So to do that, to supervise and to coordinate, I have structures that I work with. I have the quality improvement team. This is an overall team that oversees the implementation of 5As, not 5As only, but also infection prevention and control, because 5As is just a catalyst to other quality initiatives. So 5As is a quality initiative, infection prevention and control is another quality initiative. So that team oversees the implementation of 5As as well as infection prevention and control. On top of that, we have other structure, which is the work improvement team. This is at all level. these are the people that implement 5S at world level. So they are members, the chairpersons are members to the quality improvement team. Mwanza Hospital has got so many departments, but we couldn't go to all those departments at once because we've just started. We started last year in August. So we chose 5 areas. We are into administration, children's ward, maternity, laboratory, and the theatre. You may agree with me that pediatrics and maternity we couldn't leave those because they are our main focus as far as hospital activities are concerned.
The model can also be said to be a life-saving model at the hospital if you take, for example, an emergency situation in the theatre department.
It really helps us when there's any emergency because we can get things easily. We can find things easily. Wherever we have placed, we just read and we can find our instruments very easily.
We then caught up with the situation in pediatric section.
So as for 5S, we sorted our things in order so that when working like this in this situation, we don't have to go about searching for equipment or supplies. We have everything in here in the cupboards. I have syringes here for injectables. I have cannulas insert during IV fluids, and I have tubes here. For blood samples, they are there. Injectables, they are there. Lab forms, we put them there. For malaria check, these are the para check kits. So we have almost everything we need during an emergency.
By making sure that there is a high level of competition among staff at the hospital, workers are assessed by their department, and the best of them are today receiving their awards. Guest of honor is the outgoing district commissioner for Mwanza District.
I was here at the Mwanza District Health Office to preside over a function where we were awarding best performance in several areas. And in my speech, I did commend all the government employees in Mwanza. Because when I was coming here in Mwanza in 2010, I found things differently from what they are today. There are several complaints of drug shortage, drug theft, people complaining that they are not getting the necessary service that they could get from this hospital. So when we sat down as management, we said, what can we do? And we discussed several areas and strategies, which after implementation, now we are happy that people of Mwanza are being saved the way they were supposed to be. And I owe all this to all the civil servants because they heeded to my call and request.
Similar models of ensuring the best quality management at such health public institutions are also taking place in selected districts across the country and can be applied at any public institution so as to improve productivity and progress for the development of the country.